Hello, I'm Randy Swallow. Welcome to this special program about coronavirus. What originated in a food market in Wuhan, China, has traveled the world, spreading from obscurity to international headlines. There are so many questions about the coronavirus outbreak, which is officially known by the acronym COVID-19. People want to know how it's contracted, how to avoid it, how it could affect our health, our schools, our tourists, our economy. We are in the middle of flu season, and the common flu symptoms are very similar to those found in the coronavirus. Nevada Governor Steve Sisolak met with the media recently saying that the Silver State will prepare, not panic. Meanwhile, thousands of residents are emptying store shelves, stocking up on bottled water, cleaning supplies, masks, and other non-perishable food items. So is there confusion, caution, chaos? Let's meet a panel of experts who deal with events like this one professionally. Joining us from the Clark County Fire Department is the newly selected Chief, John Steinbeck. We have the Medical Director for Infectious Disease, Dr. Shadaba Assad from the University Medical Center. From the Southern Nevada Health District, Misty Robinson is the Senior Health Preparedness Planner, and also representing the SNHD, Dr. Whit Crosshauer, who is the district's medical investigator from the Office of Epidemiology and Disease Surveillance. Doctor, I'm going to borrow a line that I heard you say yesterday, and I'm sure probably everyone will agree with this, that we're not just fighting an epidemic, we're fighting an infodemic. Not to make light of this situation at all, but in many ways, there's so much misinformation. This has become a Twitter virus, a social media virus, more than a coronavirus.
Yeah, couldn't agree with this more. You know, we do want to take this outbreak of an infection very, very seriously, and many actions have been taken to prevent the spread of this infection, to identify patients as they present, to manage them appropriately. But I think one thing that we have to be very cognizant of is to not create unnecessary panic amongst the residents of the county, the residents of the state. And the only way to prevent that is to dissipate knowledge from appropriate sources. And I think it's important to not try to get your news from the news. Try to get your news from reliable sources. Sources that I depend on myself include the Center for Disease Control website. The World Health Organization is another very reliable source for this kind of information. Pan American Health Organization website puts out excellent information. Infectious Disease Society of America. And if you really want to get statistics that are very local to your community, nothing is better than the website for the Southern Nevada Health District. So yes, there is an outbreak of a disease going on throughout the world and in our country, but there is this infodemic going on that really needs to be controlled as well.
Dr. Whit, I know the coronavirus is actually one of 4 different species, similar to the SARS and MERS and some others. Talk to me a little bit about that.
Well, coronaviruses are actually a large family of viruses. So there are 4 common types of coronaviruses that cause basic cold symptoms. And there are other coronaviruses, the beta coronavirus family, that cause things like SARS and MERS. COVID-19 is a new member of that subgenre. COVID-19 is thought to have arisen in animals. We know that the initial cases were linked to a seafood market in Wuhan City. And this is not uncommon with coronaviruses. They're known to infect different animals. But now we really are seeing person-to-person transmission across the world and community spread in a lot of countries.
And doctor, I'm sure many people are coming to your hospital and others with the same symptoms that are in the common cold. Talk to me a little bit about distinguishing between the flu and coronavirus.
I would say that that's probably one of the greatest challenges that we're dealing with right now. The symptoms of the common cold, the symptoms of influenza, the symptoms of COVID-19 infection, and for that matter, the vast majority of the viral respiratory infections that we deal with at this time of the year are honestly indistinguishable. Literally, all of these patients are going to come in with fever. They're going to have a cough, usually non-productive. They'll complain of sore throat, fatigue, malaise, myalgias, some shortness of breath. So purely on the basis of clinical symptoms, it's really very, very hard to distinguish something like influenza from COVID-19. What we really use to try to distinguish COVID-19 is the exposure risk over here. So somebody with a fever and respiratory symptoms is more likely to have either a common cold or influenza rather than COVID-19 unless there is some significant exposure history. Now, I know that there have been recent sporadic cases where they couldn't really identify any obvious exposure or international travel, but those were few, and most of these patients actually had very confirmed travel history or exposure to somebody who actually did have the infection. So as of now, symptoms really don't guide us as far as identifying this disease is concerned. It's mainly the risk of exposure that raises our concern.
Now, we have had no outbreaks here in the community in Nevada at all already, Chief, and I know you're an emergency management expert, and you have procedures in place for any types of natural disasters, such as a fire and flood and things like that. If there was to be a run on coronavirus here, how would you handle it, and how would it be different from those types of natural disasters?
Well, in some ways, it's very similar for us from a structural standpoint, right? So we utilize our emergency operations plan. We don't really distinguish between a different type of disaster or emergency as far as that structure goes, other than who the lead agency is. In this case, our lead agency is the Southern Nevada Health District here locally for the emergency operations. Then it's a matter of an emergency declaration if one is warranted, and then taking on the proper precautions and also actions that are warranted for this particular instance. So if it's few or larger numbers of quarantine or isolations, whatever resources it is that is necessary to make that happen, that's my job then to make sure that we get those resources completed. And then the biggest thing is agency coordination.
Misty, planning and preparedness obviously is huge in any situation, and that's what your job is, and that's what you do, working in coordination in emergency management. So what type of coordination has there been with healthcare providers, schools, emergency management, community partners?
So we actually had a community meeting with our emergency management partners, as well as schools, hospitals, healthcare facilities, long-term care facilities, and then this morning we actually had a meeting with the hotel security chiefs to provide them with information. So we are going to be providing information weekly to those groups so that they can have an idea of where we are and what's going on in the community so that they can be prepared, especially emergency management, who will be looking to support our efforts. We currently are in an emergency management structure called Incident Command System, which basically helps us to focus some of our efforts or focus people on this particular incident.
One of the most important things at this stage is making sure we're coordinating our resources appropriately. The health district, the way it normally functions, is that different divisions have different sort of areas that they focus on. What standing up the incident command system has allowed us to do is to make sure we're communicating across divisions, making sure these groups are working together for a single purpose. As Chief Steinbeck mentioned, it's making sure we're communicating and speaking the same language. And it's also right now is the time to strengthen communication with our partners and making sure we're coordinating. We want to set these steps up ahead of time before we really need them.
And does that even work then for large-scale events? I know we've got things like the NFL Draft, the EDM Music Festival coming up, where literally hundreds of thousands of people will be coming from our city from all of the places. We're looking at those types of events also?
Yeah, absolutely. So the command structure is set, right? And so then we fit the emergency event into the command structure. Some of the representatives within the structure might be different, certainly for like the special events that you mentioned, other large-scale emergencies that we've had, but the structure is what we follow. So certainly the fact that we have a lot of hysteria right now about this virus isn't going to knock us off of our plan. We still follow our plan, and that's the only way we'll be successful in mitigating this. So we would still follow the same structure.
And we do this so that we can ramp up as much as we need to, depending on what's going on in the community. Right now, since we have no confirmed cases, we're keeping our incident management structure very small, but we have the capability to ramp up and to make sure that everybody, we're getting control over the situation, and we'll probably ask the county to stand up their multi-agency coordination center to help us out and help try and get those resources.
Let's backtrack a little bit, Doctor, and talk about individual preparedness. Obviously, we've heard many things. If you're sick, stay home, wash your hands a little bit more. And masks, obviously, there's much to be said about that. Just talk to me about some of the basics.
Right now, we're really recommending that people take some of the precautions that you mentioned already. So hand washing is very important. I know everyone thinks they're washing their hands appropriately. Not everyone's doing it for 20 seconds. They're not necessarily, using... hopefully people are using soap, but they're not necessarily doing it for the length of time. People like to touch their face. It's just a tick that we have as humans. You like to rub your nose or scratch yourself. And those are things that, you can potentially inoculate yourself. So if you're touching a table, someone sneezes on that table, and then you rub your nose, if there's a virus there, it can get into your mucous membranes. We want to make sure that people are practicing basic cough and sneeze hygiene. So the best thing is to take a Kleenex, sneeze or cough into it, and then throw it away, and then wash your hands. If you don't have a Kleenex, coughing into your elbow. And then, there's been a lot of discussion about, people hoarding supplies and things like that. Masks are not effective or not recommended for the general public. And the reason being is the main purpose of surgical masks is really to prevent people who are sick from exposing others. So I'm sure we've all seen that video of someone sneezing and there's a blackboard in the background and you see all those particles just spreading everywhere. The mask basically allows or basically blocks those particles from impacting other people. So that's the main purpose of the mask. Healthcare providers are in a slightly different situation because they are really up close with people who are sick, so they're looking into their mouths, they're really in close contact. So for healthcare providers, the N95 mask is more important. For the general public, if you're just walking around grocery shopping, those are not steps that we recommend. And I think they really provide a false sense of security. So someone who's goes to the hardware store and buys an N95 mask and they're wearing it, but they're still not washing their hands or they're still rubbing their eyes, they may have that false sense of security and they may stop doing those other actions that are actually effective.
Anything you'd like to add, Doctor?
The funny thing about what Whit mentioned is the other day I was watching this, they were showing a program on the TV and the sound was on mute, so I have no idea what they were talking about, but it was a subway scene, there was crowds of people going, they all had masks on, but here's the funny thing. So half of them had their masks around their neck, the other half had the nose exposed and just their mouths covered, and they were touching everything in the subway and they're leaning really close into each other. So that false sense of security, just because you've got a mask hanging around your neck, is not going to do anything at all for you. If you want to do anything for yourself, clean your hands. Soap and water for 20 seconds is good. If you don't have access to that immediately, alcohol-based hand sanitizer will do it. So, and then if you're coughing and sneezing, don't cough and sneeze on other people. And if someone is sick, stay away from them. If you have a cold yourself, don't go to work and expose your colleagues to that infection. So, simple measures.
Doctor, I also heard you talk yesterday about flu season. I mean, we are in the midst of flu season. There's some 30 million people with the flu or cases during the past few months here. Right. Talk to me about the fatality rate and just some commonalities between common flu and coronavirus.
Commonality, other than the fact that they're both viral infections, and the fact that both of them clinically can present quite similar and they're both attacking the same time of the year, I don't think there's much more commonality to that. They will both present with a high-grade fever. For flu, it's usually fever and just aches and pains. Most patients are going to just start saying, I feel like I've been hit by a truck. That and the fever. And then some of them will have a cough and a little bit of a sore throat. Those are the symptoms of flu patients, and it is more likely that someone coming to your office or clinic with these symptoms has the flu rather than COVID-19 infection. But based on the symptoms, it's really not easy to distinguish the two of them. As far as mortality goes, it's important to understand COVID-19 is an infection in evolution. As time is going on, we're learning about it. But as of now, the mortality reported, when they started out, it was said to be about 2.3% in China. I've seen reports that are now talking about 4%. In the US, it's actually very, very low as compared to China. For influenza, though, the mortality is actually much lower at 0.1%. So the mortality with influenza tends to be lower. We see more deaths because of the sheer number of flu patients that we see every year. We actually have effective vaccines for influenza. We have effective treatment for influenza. Those are some very different things about influenza. Here's another thing about influenza. I wouldn't say it's a commonality, but something worth talking about. You know, now that this outbreak has happened, people can't stop talking about, is there a treatment for COVID-19? Is there a vaccine for COVID-19? But nobody is interested in the vaccine for influenza that's been there around for years and years. Millions of people get sick. Thousands of people die every year. You've got a vaccine, and healthcare providers and public health officials are begging you to get vaccinated, and nobody's interested. Those are things I don't quite understand.
How does one get these vaccines? Can people come to your hospital, come to the health district for?
Yes, so we are in the middle of the flu season, so you can reach out to the health district. We do provide flu vaccines. You can reach out to your primary care doctor. A lot of pharmacies offer vaccines, so there are a lot of resources out there. And if I could say one thing about the mortality for COVID-19, right now what we probably are seeing is there's a lot of underreporting of cases with mild symptoms or no symptoms. Yeah, so right now, you know, if you are in a country that's affected, if you don't have any symptoms at all, or if you have very mild symptoms, chances are you're probably not going to go to the hospital. You're probably not going to get tested. So it's very possible that there are a lot more people in some of these countries that have COVID-19 that are not being counted. And what that does, it basically inflates the mortality rate or the death rate. And so it's possible that the death rate is actually lower than what's being reported. And you see this especially in countries where the cases are new. So, for example, in Iran, when they started seeing cases, there were a lot of deaths compared to the number of cases they had. And that almost certainly has to do with undercounting. So that's both good and bad news. The bad news is that means there are probably more people infected than we know about. The good news, it probably means that the mortality rate is lower than we are seeing in the media.
Yeah, that's an exceptionally important point. You know, when news started coming out of Iran, they were talking about mortality rates of 20%, which was not accurate. It just meant that if they were seeing that much mortality, it probably meant they had a lot of cases that were undetected, not that the mortality was so much higher in that country. And probably same in China. When all will be said and done, maybe the mortality is actually going to be lower than what we're seeing right now.
And there are companies right now working on a vaccine for the coronavirus. So as soon as that's available, we'll be provided that by the CDC so that we can offer that to the community as a whole.
Is any guess on what's the time frame for developing a vaccine similar like this?
So what we're hearing is that it'll be between a year and 18 months. So that's why we're really focusing on the non-pharmaceutical interventions like don't touch your face, don't shake hands, cough in your sleeve, as Dr. Witt was mentioning.
If it ever got to that, Chief, I know you and all people in emergency management, you conduct many mock exercises, and you've done ones for fires, planes crashes, floods, and things like that. And I know a recent one was actually something that could play into this, where you actually distributed medicine.
Yeah.
Talk to me about that. If somebody, all of a sudden, there was a widespread pandemic in our community and people, gosh, needed shots or pills, we're prepared. You're covered on this.
Yeah, so we have a plan in place. We have exercise, and we exercise it every year to some degree. And that is to get the needed medications out to the community. So we do what we call pods to distribute out that medication. Some are for internal organizations like the fire department. That would be only for the fire department, but some are for the public as well. And we go ahead and we would push out where those locations are. It's a fairly efficient, I think it's a very efficient program as far as the speed and the getting the medications that you need. It's very kind of a easy lift as far as the person that needs them. All they got to really do is show up and say, hey, this is where I live and this is what I need, and you're going to get your medications. So from whether or not it's coming from the strategic stockpile or, you know, in some cases, or wherever this vaccine, how that would be distributed down to the state and then to the local levels. At the local level, we're very efficient in being able to push that out. We don't have any concerns along those lines.
And exactly what Chief is saying. We work very often with the county fire and other emergency management partners to make sure that we can open these points of dispensing, and that way we can quickly get these vaccinations into the public. However, there probably will be a tier system with this virus or with this vaccine, because there's not going to be enough for everyone. So depending on the epidemiology of the disease at the time we receive the vaccine, then the CDC will decide what tier groups should get that vaccine first.
Like H1N1.
Exactly like H1N1.
And I think it's important to know that although there has been an unprecedented amount of work and interest in developing these medications and vaccines, those are, in the mid to long-term distance. So right now, the efforts need to be focused on those non-pharmaceutical interventions, not only at a personal level, but at an organization level. Businesses need to think about how they're going to prepare to protect their employees, healthcare organizations, how they're going to protect their healthcare staff. And those are really the items that we want to focus on now, and those things we need to think about.
I was at your UMC town hall yesterday where you and others were leading. There must have been 100, 150 of your employees from doctors in every part of your hospital. That, gosh, that's what the doctor just said. If people at your place get sick, then that you obviously can't perform your mission properly. Tell me what is being done at your hospital and what you think is being done in other healthcare providers to help ensure that doesn't happen.
I think one of the first, so UMC has been involved in emergency preparedness activities, drills for years now, right? But what we realized with this current outbreak, particularly with all the talk that was going on in the media, was that there was this sense of unrest and fear amongst all of our employees. And one of our main missions with arranging that town hall was to actually communicate with our staff. So one of the main things we're doing in our hospital right now is communicating with our employees, with our physicians, with our healthcare providers, answering their questions, their concerns. The other thing is ensuring the safety of the healthcare providers. These are the people who are at the receiving end of probably the first person who will have the infection. We want to make sure that that person at triage who is exposed will be safe. So a lot of measures have been put into place to protect those people. Similarly, we worked on our workflow in the hospital to ensure that these patients are passed through the hospital in a manner that is that they are provided with effective and rapid diagnosis and management, but at the same time our employees are also provided with protection. Any employee who actually gets in contact with someone who is subsequently confirmed to have the disease will actually be monitored by our employee health services to make sure that they continue to do well, and we will monitor them for the next 14 days for that. So lots of different things, daily meetings to make sure that our emergency preparedness things are all up to date. We've done a lot of work on our influx plan in the event there is a pandemic declared in the world and there is an increase in number of patients. How are we going to handle an increased number of patients, as well as try to continue our day-to-day activity and take care of our other patients in the hospital. So lots of different things going on at different levels, but I think the one link that was missing was communication.
We just have a few minutes left, so let's just go around and have each of you give the most important message. Doctor, what is the most important message from your perspective?
From my perspective, the most important message is that prevention message. So even though it sounds very basic, the hand washing, the not touching your face, the cough and sneezing hygiene. And then I would like people to take actions that will actually protect themselves and not waste their time and energy on things that won't protect themselves. So, driving around town and hoarding face masks, those are actions that won't protect you. Doing things like, making sure that you have an emergency plan for yourself and your family, those steps that we recommended prior to this, having a disaster kit, those are good things. Hoarding, shopping carts filled with toilet paper is probably not as effective. So we want people to take control of this, but to do actions that will actually protect them.
Misty?
So I would say that as a health department and as a community, that we are prepared in the event of that we receive any positive cases here. We have plans in place. They have been tested over and over and over again. So we are ready for a potential large number of cases in the valley.
Chief?
Yeah, so the message that I'd push out is to pick up off the doctors is a preparedness one, right? So he's stressing the prevention and discussing the preparedness. But if you prepared for in all of the emergency scenarios that we put forward on our websites and on ready.gov, then that's going to really help you to prepare for this, right? So if you're isolated or quarantined for 14 days, we want you to have already had a plan on to what that's going to go ahead and look like. And so that's individual and business and government preparedness, right? It's all the way across the board. So I've used this as an opportunity to discuss it with my family, right? Which are in 3 different states, to say, hey, all right, start thinking about, without a panicked type of issue, but they're in states that, they're in California where there's earthquake prone, right? So even though we've talked a lot about your preparedness, think about it now in a 14-day type of scenario. And then and we're going to push that message out a little bit more, utilizing this as an opportunity for a more receptive audience on that preparedness message. But it has to be all the way across the board. Also, your business continuity of operations plans. If those aren't in place, if you haven't done those, use this as an opportunity to start thinking about it. It could be this virus, could be influenza, could be another type of illness that can just wipe out your office for several weeks. How are you going to go ahead and continue? And especially if you're a vital member of the community that provides a very needed service during some of these times, you really have to think that through as well. So again, through our Office of Emergency Management, we can give you the documents that can assist you with that. But that preparedness message is our key.
And final words, Dr. Assad?
Final words is the same that University Medical Center has been putting out. With this COVID-19 outbreak, the fear is understandable, but the antidote to that fear is knowledge and preparedness.
Thanks to our authorities for shedding light on the coronavirus outbreak. Obviously, this is a very fluid situation, and no one knows for sure how this epidemic is going to end. For the latest information on from the nation's Health Protection Agency, go to the Centers for Disease Control and Prevention website at cdc.gov. And for more local facts, head to southernnevadahealthdistrict.org. I hope you've gained some useful information about coronavirus and what's being done. I'm Randy Swallow. Thanks for tuning into Clark County Television.